अरे यार, why this Deepak bring his elderly father to play? पता नहीं।
He can't even hold the golf club properly.
हाँ
Even
यार।
his walking style has changed.
चल अब तू जाके बोल उसे कि थोड़ा जल्दी करे।
अरे मैं ऐसे कैसे बोल दूँ? It will be so rude.
हाय दीपक, आप लोग क्यों नहीं थोड़ा आराम कर लेते हैं? आज ऐसा लगता है कि अंकल कुछ ज़्यादा थके हुए हैं। कुछ परेशानी है?
Yeah, he's a bit off today.
Oh.
His Parkinson's has suddenly started worsening. तो इसलिए पापा आप थोड़ा रेस्ट कर लो, एक सिंडोपा डोज ले लो एंड थोड़ी देर में असर भी दिख जाएगा। थोड़ी देर में असर दिख जाएगा पापा, आराम कर लीजिए।
ओह, मुझे नहीं पता था अंकल को पार्किंसन है, सॉरी।
For many years, he was responding well to Syndopa medicine and other tablets. और normal थे। He has this problems in movements. तो हम लोग we've considered a lot of doctors यार, but everything is very frustrating.
इसकी सर्जरी के बारे में विचार किया है?
You mean the pacemaker implant in the brain, DBS? It's very expensive यार and constant follow up करना पड़ता है।
इसका एक दूसरा प्रोसीजर है। क्या नाम है हॉस्पिटल का? लेट मी चेक। यस, PRS न्यूरो साइंस। एंड इनका एक इंस्टीट्यूट भी है जिसका नाम है IMDSN।
इसके बारे में सुना था, but they work only on the movements, right? वो guitar movements, if I'm not wrong.
No, they do all sort of neurological treatment for brain tumor, head injuries, stroke, spinal problem, Parkinson, spasticity, dystonia, etc. तो इनफैक्ट मेरी जो बुआ जी हैं उनको भी ये डिसीज़ थी पार्किंसन की, और उनको इससे अभी काफ़ी लाभ हुआ है। अभी वो बहुत ज़्यादा बेनिफिट हैं इससे, और शी इज़ डूइंग फाइन नाउ।
अच्छा, I didn't know about your बुआ। सब कुछ ठीक है अभी?
नहीं, अब बिल्कुल ठीक है। उनका लड्डू बनाने का शौक था, तो वो अभी वापस से अपना लड्डू बनाती हैं। इनफैक्ट यू डोंट नो, वो लड्डू बनाने के साथ साथ उसका बिजनेस भी कर रही हैं, और शी इज़ क्वाइट हैप्पी। वो बहुत खुश हैं अपने इससे, और इनफैक्ट द ट्रीटमेंट जो उनको मिला था उसके बाद तो वो इतनी खुश हैं जैसे उनको कुछ नया अवतार मिल गया है, नया जीवन मिल गया है। और ये देखिए, इनका अलग से एक चैट बॉट भी है। आप इसमें अगर अंकल का डिटेल डालेंगे तो वहाँ आपको सारी इन्फॉर्मेशन वो आपको प्रोवाइड कराएंगे, आपको मदद करेंगे, एंड आपको ऐसा बिल्कुल नहीं लगेगा कि जैसे कि मैं कोई गलत जगह पे आया हूँ। सो दे विल हेल्प यू आउट विद ऑल रेस्पेक्ट।
थैंक्स यार।
Now, regarding that call that you got outside the court, I mean, how is it Dr. MK is concerned if a nurse extubates a patient?
See, extubation is the removal of that tube that is put inside the windpipe via the throat, and then it's connected to the ventilator, and that's basically supporting the breathing, right? It's very tricky to know when exactly is the safest time to remove this tube. That's called extubation. And if you remove the tube and then the patient is not able to maintain the breathing, starts dropping oxygen, starts collapsing, can even die, that time it's very important to reinsert that tube back. That's called reintubation. And if that reintubation has to be done by a skilled doctor.
Oh, so it's a lot of risk if you're not around then.
Yeah, and that's why Dr. MK made such a big hue and cry about it. And as usual, again, I ended up in the boardroom in front of Dr. Solochana and Dr. Albert.
And now what has happened, Dr. MK? Ma'am, I want to bring a very serious matter to your attention.
What is that?
It's about the critical care of our patients. Dr. Sharan is in charge of the ICU. Dr. Sharan, may I ask you, when were you last in the ICU?
Sir, yesterday between 2 and 8 p.m., sir.
And during those hours, where were you?
Sir, actually, I was an expert for disability assessment at the court yesterday between 2 and 5 p.m., sir.
Ma'am, he was in court yesterday while nurses extubated 2 patients. This is a serious lack of protocol. Some of the patients could have died.
But did we? Did anything happen to any patient?
There's no point in discussing this. There is a huge lapse of care. Simple.
This seems like a very serious issue.
Yes, ma'am, it is a very serious issue. And this is not a stray incident. It has been brought to my notice that Dr. Sharan has been missing from the ICU on several occasions. The ICU was manned by nurses. They extubated 2 patients, which is not our protocol. He was not there during that period of time. This is a very risky situation.
Is all this true, Dr. Sharan? These extubations, increased mortality, and all these other things?
But did anything happen to any patient? Nothing happened to
Ma'am,
anybody.
the extubation part is true, but not the mortality part. Ma'am, these patients are extubated under the supervision of highly trained nurses, ma'am.
Nurses cannot re-intubate, period. Ma'am, this is the reason for a high death rate in the ICU. Nurses cannot re-intubate.
Sir, but they don't have to. When I left, Dr. Sham was in charge of the ICU and I've been managing them with very trained hands and I'm taking full care of my ICU. Ma'am, please take a look. We have a very robust extubation protocol in place, which we've created under the guidance of Dr. Albert, Dr. Iyer and the anesthesia team. And we've supervised, I have personally trained over 10 senior nurses. And for each of the nurses, I have not only supervised them, but also helped them extubate in 5 patients each. So the extubation is not going to be an issue under these nurses. And can you please, ma'am, you can look and show me whether in the last 6 months, has there been any extubation or re-intubation? There have been over 250 of them over the last 6 months, ma'am. Yeah.
Actually, there have been no re-intubations in the ICU since last 6 months.
Okay, ma'am. But what about the increased mortality in the ICU, ma'am? I've been informed by residents that the mortality rate in the NS ICU has gone up.
Yeah, I see that. The ICU death rate over the last 6 months has been 8%.
Ma'am, now there are always patients who come in such critically ill conditions, near death conditions when they're referred from emergency or they're referred from the neurology ICU. It's not always possible to save everyone, ma'am. You know that very well. But ma'am, I've been looking after the ICU since the last 6 months and you can see on the records that the mortality has been controlled to a great extent. You can see the numbers that were there before I took over the ICU.
How does that matter?
Of course it matters. It matters. There is no ICU in the world where deaths don't occur. Clinical conditions can be very critical in neurosurgery and in a very high tertiary like ours. But without looking at the data before Dr. Sharan took over, we cannot conclude whether things are better or worse now.
Fair point, Albert. I can see the mortality percentage in the ICU before Sharan took over was... What? 48%? Really? 48%? This is way too much, MK. Did you know about these stats? 48% mortality rate in a high-end tertiary hospital like us is unacceptable. I'm shocked, appalled.
No, ma'am, I didn't know about this data, but maybe he could have fixed it.
Of course he is not, MK. Can you see this? He has given the complete list of patients with their DOA, DOD and OP, IP numbers.
He's probably just been lucky, ma'am, that in the last 6 months the mortality rate has come down. that doesn't mean he's doing his job well.
Ah, lucky. Come on. Delivering consistently good outcome of 500 plus patients in a 20-bed ICU tertiary is not fake. It cannot be attributed only to luck. Ma'am, Dr. Sharan is practicing a very strict and very structured protocol which he has meticulously made under my guidance, And I'm very proud that his team executes that protocol on the ground level 24/7 meticulously.
Sharan, though your results have been good, we cannot allow remote management of such critically ill patients. Fortunately, nothing has happened so far, so we cannot take any action against you. But we cannot allow such things to continue. Is that clear?
Ma'am, I respect your judgment. I respect everyone over here and their concerns that they've put out. But ma'am, if I am not able to work in a manner that is comfortable for me so that I can take care of my patients, whether I am in the ICU or outside the ICU, I will not be able to do justice to the treatment for them, ma'am. And if I'm not able to work in a manner that I can be effective, then it makes no sense for me to continue, ma'am. So I have no other choice, but I would like to offer my immediate resignation. Thank you.
So you basically just resigned and walked out like that?
Well, if I'm not able to treat patients with the best of my abilities in my own way and, with my own knowledge and experience, I don't think I'll be doing justice. And it didn't make sense. So I thought, I should make that decision. And then I started working at PRS Neurosciences and started doing my surgeries at Bhagwan Mahavir Jain Hospital.
Yeah, I think that was the moment when we were able to truly dedicate ourselves to the philosophy of PRS Neurosciences. The world can't afford disability. We want people to stop spending money on disability welfare and rather have them invest in rehabilitation.
Wow, this is such a powerful story. But it is incomplete without knowing why Dr. M.K. Singh had such powerful negative feelings towards you. It just can't be jealousy. It almost looks like it was something personal that he had against you. See, I know you had asked me to not talk about this case where he had challenged you in that public conference. But at least tell me, doctor, why is it that he is trying to pull you down all the time?
Doctor,
Yeah.
the procedure is ready.
Yeah, so that just tell Sister Ravina that I keep everything ready and I'll come directly to the OT for the procedure, okay? Yeah. See, Miss Anisha, since you insist so much, but you have to promise me one thing, that this will not go on your record, all right? And secondly, this is going to be the last question because as you can see, I have to go and perform this procedure, all right?
All right, works. I promise.
Okay. Well, actually, Dr. M.K. Singh was never this bitter and negative, actually, as a person. In fact, he was quite the opposite. He was very positive, very encouraging, very supportive to his students, loved teaching. In fact, I remember, when Dr. M.K. would walk in his morning rounds, there would be an entourage of students, walking all around him.
In neurosurgery, daily documentation of a patient's status and progress is extremely important.
And he would be every neurosurgeon or every student's dream teacher, like everyone wanted, to be like if Dr. M.K. is his teacher. Like I wanted him to be my guru so badly that I actually chanted the Guru Stotra mantra thousands of times every day. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. And when he would post a surgery, he would let someone as junior as me to actually do the surgery as the primary surgeon, and he would assist. And not only would he just assist, he would teach, he would guide, he would correct.
Go a bit more lateral. Now get the plane of the hematoma and the white matter. Then carefully debulk it while simultaneously achieving hemostasis. Yes, very good, Sharan. Very good.
And he was very particular about some things, like once when like I learned the most during his morning and evening rounds, like especially one day when I was on these rounds. It was a very, very busy night duty. I hardly slept and there were so many patients, and I just forgot writing notes for that one patient. And that day on the rounds, he told me something very important.
Dr. Sharan, looks like you've had a busy night.
Yes, sir. There were 17 new admissions last night, sir.
All strokes?
So 10 head injuries, remaining strokes, sir.
Okay, let's look at the critical ones.
Yes, sir. So this patient is a 42-year-old man. He came with a head injury last night. He was under influence of alcohol, sir.
Who did he hit?
He didn't hit anyone, sir. He was going to take a leak and he fell down into a ditch. He was brought at 2 o'clock in the morning with a GCS of 14, sir. But now his condition is much better, sir.
Sharan, where are your morning notes?
Sir, actually, because the emergency was so busy, sir, and I called and checked. He was fine in the night, but there's too many patients. And
Sharan, I don't care if you have not slept. I don't care if you've not eaten. I don't care if you've not gone to the bathroom. How can you not maintain at least brief work notes? I can understand you can't do detailed, but brief work notes, how is the other doctor to know what's wrong with the patient if something happens to him? How is he going to treat him? It's very important.
yes, sir.
However brief, but you have to maintain work notes, brief work notes.
I'll do that, sir. His next patient is a patient of stroke, and his reports have come. And these are just some of the valuable things that I learned from Dr. M.K. Singh.
So what happened then? He seemed to like you so much.
Everything went wrong after one big misunderstanding. Sharan was just in the wrong place at the wrong time.
See, power, money and love can change anyone. And Dr. M.K. Singh was loving the attention every bit, especially what he was getting from some young students.
Oh, don't tell me.
So there was this neuro rehab student, her name was Sushma, and she was doing a neuropsychology certificate course that was run by Dr. M.K.'s wife, Dolly Singh. So she was posted in Dr. M.K. Singh's unit for neuropsychological treatment for some of his patients, and the spark between them started to grow so much that everyone would notice it.
Good work, doctor.
Thank you, sir. Nothing compared to you. Just learning from the best.
And as the spark grew bigger, they turned into actions. And Sushma would spend a lot of time in Dr. M.K.'s chamber with the doors closed. And I was not aware of this at all until one day Dr. Dolly Singh, his wife, came looking for Dr. M.K. Singh.
Sharan,
Yes, ma'am.
have you seen MK?
Sir finished his rounds early. He must be in the planning room, ma'am.
Planning room.
I'll show you, ma'am.
Take a look into my eyes and see the fire that burns slow. Put your hands upon my face and promise me you'll never let go.
What the hell's going on here?
Dolly, it's not that.
You. In my chamber now.
Dolly, don't make a scene. It's not what you think it is.
Don't you try this on me, Mahendra.
Dolly, suno.
We've got love on fire. Come on, baby, let's show 'em we're here to stay.
And Dr. M.K. Singh saw me standing outside his chamber and he thought I had something to do with it. But honestly, I was really surprised and shocked at that point of time. And then that story blew out of proportion, became like the gossip of the hospital, and eventually Sushma had to be fired.
Unbelievable. What drama. I mean, I can't believe a doctor at his level would get involved in something like this. I mean, that's not done.
The drama had only just begun. After Sushma got fired, her position became vacant and I was next on the wait list.
So MK took advantage of this situation very cleverly, and he convinced Dr. Dolly that, you know, this is our plot, you know, to get Sushma fired so that Pratibha could get, you know, her position. And I think this is one of the biggest reasons why he wanted to take revenge from me, because he thought I was responsible and he blamed me for that entire situation. Like, he even stopped teaching me, stopped talking to me properly. He even refused to sign my thesis. I mean, I went to his chamber requesting him to sign my thesis one day.
Sir, thesis, sir.
You think I'm going to sign your thesis after you ruined everything for me? Let me tell you something, Dr. Sharan. You are never going to be a neurosurgeon, because I'm never signing that. Never.
Sir, I was there only in the wrong place at the wrong time, sir. I was simply filling out forms. Ma'am only came and then she entered inside, sir. So please don't spoil my future for a misunderstanding, sir.
Sharan, don't try to cover up. I know you did it on purpose. That's the kind of person you are.
No, sir, it's not true, sir. I was just...
Look, I've got to go see my patients now. Will you leave? Please leave.
So unfair. I mean, how could he do this to you?
Yeah, I always felt really bad that, you know, I was one of his favorite students and he didn't trust me, and this became like an unsolvable problem for me. Like, he never signed my thesis.
But then how did you complete your course if you never signed your thesis?
Dr. Albert came to the rescue. Dr. M.K. Singh was on leave, and so Dr. Albert became the acting head of the department, and he signed it.
Wow, what a savior. But Dr. M.K. Singh must have been furious for sure.
He was furious. He created a ruckus. He, you know, he tried to bring, he tried to blame that, you know, I forged the signatures or something, and, you know, tried to tell Professor Sulochana, and tried all sorts of things. But at the end of the day, the signatures were legit, and then, you know, it went through for my completion of my course.
Honestly, if I had to go through so much, I would never be able to work in a place like this. Hats off to your persistence and your determination.
All right, Miss Anisha, I think this is the end of our interview, and it was so nice talking to you. I need to leave. I have a procedure to carry out now.
Can I come for the procedure?
I don't think we can allow that, but you're free to walk around the facility and talk to some patients. You can see how much progress they've made. Actually, Sid, could you show Miss Anisha around?
All right.
Okay, thank you. Thank you. Thank you.
All the best.
Hi. You want to know about the case that they were challenged at the conference?
Of course I want to know. You know about it?
Yeah, I know everything about it.
Really?
Yeah, and I can tell you.
Yeah, that'll be great. That would be really helpful.
Sure. We can talk while I show you around.
Sure, why not?
You've won my desire, and no one can ever take that away. We've got love on fire. You gave me the world. And now we're going higher, higher than we've ever been before. Love on fire. You're just the kind of girl that I was dreaming, I've been dreaming of. And I wish there was a deeper kind of word that could describe our love. Close your arms around me tight and hold on. Let me stay here a while. And softly kiss me like you do, the kind of kiss that forces my lips to smile. We've got love on fire.
आँख खोलो, ऊपर देखो, आँख खोलो, ये हाथ उठाओ, हाथ उठा सकते हो? Pain for stimulus once, okay? Third out. मोड़ो. Very good. सीधा करो. शोल्डर टच करो. सीधा करो. नीचे रखो. ओके. यस. 6 के बाद राइट पैर लिफ्ट कीजिए. ये वाला पैर लिफ्ट करो. आपको हाँ कितना अच्छा लगा. थोड़ा या ज्यादा? ज्यादा अच्छा लगा. क्या क्या खाने वाले हो अभी? अब बोलो क्या क्या खाओगे आप?
ಲೆಫ್ಟ್ ಫಿಂಗರ್ ಮೂವ್ ಮಾಡಿ.
ಫಿಂಗರ್ ಹಿಂಗೆ ಹಿಂಗೆ
ಆಗಲ್ಲ.
ಬೇರೆ ಕಡೆ ಆ ಕಡೆ ಎಲ್ಲ ಇರ್ತಾರೆ. ಎಲ್ಲೆಲ್ಲಿ ಇರ್ತಾವೋ ಎಲ್ಲೆಲ್ಲಿ ಕಾಣಿಸ್ತೈತೆ ಅಲ್ಲಿ ಮಾಡಿ.
ಆಯ್ತಾ ಸರ್? ಆಯ್ತಾ? ಓಪನ್ 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 ಓಪನ್. ಟ್ರೈ ಟ್ರೈ. ಕ್ಲೋಸ್ ಕ್ಲೋಸ್.
ಅಲ್ಲಿ ಹೋಗ್ಬಿಟ್ಟು ಬನ್ನಿ ಸರ್. ಬನ್ನಿ ಬನ್ನಿ.
ಕಾಲ್ ನನ್ನ ಸೈಡ್ ತನ್ನಿ, ನನ್ನ ಕೈ ಮುಟ್ಟಿ, ನನ್ನ ಕೈ ಮುಟ್ಟಿ. ಈ ಕಡೆ ತನ್ನಿ, ಈ ಕಡೆ ತನ್ನಿ. ಫುಲ್ ಈ ಕಡೆ, ಫುಲ್ ಈ ಕಡೆ. ಈಗ ಕಾಲ್ ಎತ್ತಿ ನನ್ನ ಕೈ ಮುಟ್ಟಿ. ಮಂಡಿ ಸ್ಟ್ರೇಟ್ ಇಡ್ಬೇಕು. ಮಂಡಿ ಸ್ಟ್ರೇಟ್ ಇಟ್ಟು ನನ್ನ ಕೈ ಮುಟ್ಟಿ. ಬಿಡಿ. ತುಂಬಾ ಹೊತ್ತು ಮಾಡಬೇಕು, ತುಂಬಾ ಸಲ ಮಾಡಬೇಕು. ಬೆರಳು, ಮೂಗು, ಈಗ ಎಡಕೈಯಲ್ಲಿ ಬರೀರಿ. ಕರೆಕ್ಟ್ ಬರಿಬೇಕದೇನು? ಹೆಸರು ಬರೀರಿ ನಿಮ್ದು.
ಅದಕ್ಕೆ ಮುನ್ನ ಸಿಎಂ ಕೆಳಗಡೆ ಆಗಲಿ.
ಇದನ್ನು ತಗೊಳ್ಳಿ.